Ec-Naproxen is a medication used to relieve mild to moderate pain from various conditions and to reduce pain, swelling, and joint stiffness from arthritis. It is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking the production of certain natural substances that cause inflammation in the body. If you have a chronic condition such as arthritis, it's important to talk to your doctor about non-drug treatments or using other medications to treat your pain. It's also important to note that Ec-Naproxen is absorbed slowly, so it should not be used for pain that requires quick relief, such as during a gout attack. Be sure to ask your doctor or pharmacist about using a different form of this drug or other medications for quick relief of pain. As for the daily dosage and optimal timing, it's essential to follow your doctor's instructions and take this medication exactly as prescribed. Before you start taking Ec-Naproxen, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily with or without food. Swallow the whole tablet with a full glass of water, and do not lie down for at least 10 minutes after taking it. The dosage is based on your medical condition and response to treatment, so make sure to take it at the lowest effective dose for the shortest possible time. For certain conditions, such as arthritis, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. And remember to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Ec-Naproxen include upset stomach, nausea, heartburn, headache, drowsiness, or dizziness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. This medication may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Serious side effects that should be reported to your doctor immediately include easy bruising/bleeding, difficult/painful swallowing, hearing changes, mental/mood changes, signs of kidney problems, unexplained stiff neck, vision changes, symptoms of heart failure, nausea/vomiting that doesn't stop, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes/skin. While rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Now let's talk about the uses of Ec-Naproxen. It is a nonsteroidal anti-inflammatory drug that can help relieve pain and reduce inflammation. It can be used to treat conditions such as arthritis, muscle aches, menstrual cramps, and other types of pain. It's important to follow the recommended dosage, which is usually taken with a full glass of water. It's best to take Ec-Naproxen with food to help prevent stomach upset. However, it's important to be aware of the potential risks. Ec-Naproxen may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It's important to talk to your doctor or pharmacist about the benefits and risks of taking this drug. It's also important to be aware of potential side effects, such as stomach pain, black/tarry stools, or chest pain. If you experience any of these symptoms, it's important to seek medical help right away. Overall, Ec-Naproxen can be effective in treating pain and inflammation, but it's important to use it carefully and be aware of the potential risks. Always talk to your healthcare provider before starting a new medication. Before taking Ec-Naproxen, make sure to inform your doctor about any allergies you have to medications, including aspirin or other NSAIDs. Also, tell your doctor about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. If you experience kidney problems, dehydration, heart failure, or are an older adult, talk to your doctor about the risks associated with taking this medication. It's important to stay hydrated and report any changes in urination to your doctor. Be cautious about activities that require alertness, as this medication may cause dizziness or drowsiness. Avoid alcohol and marijuana use, as they can increase these effects. Also, be aware that this medication may increase your sensitivity to the sun, so it's important to limit sun exposure and use sunscreen. If you are an older adult, be mindful of the potential risks of stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Additionally, women of childbearing age should discuss the benefits and risks with their doctor, as this medication can harm an unborn baby and affect labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if used between 20 and 30 weeks, it should be at the lowest effective dose for the shortest possible time. It's also important to consult your doctor before breastfeeding, as this drug can pass into breast milk and have undesirable effects on a nursing infant. When taking Ec-Naproxen, it's important to be aware of potential interactions with other medications. This includes drugs like aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, and water pills. Additionally, avoid taking this medication with antacids or other drugs that decrease stomach acid, as they may affect the enteric coating of the drug. It's also important to be cautious when taking Ec-Naproxen with other drugs that may increase the risk of bleeding, such as antiplatelet drugs or blood thinners. Check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that may interact with Ec-Naproxen. Furthermore, Ec-Naproxen may interfere with certain lab tests, so be sure to inform lab personnel and your doctors if you're taking this medication. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines when taking Ec-Naproxen. If someone has taken too much Ec-Naproxen and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center for assistance. Symptoms of an Ec-Naproxen overdose may include severe stomach pain, extreme drowsiness, and seizures. If you suspect an overdose, don't hesitate to seek help right away. It's important to not share this medication with others. Your doctor may require you to undergo lab and/or medical tests, such as blood pressure, complete blood count, liver/kidney function, while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you have arthritis, making lifestyle changes such as weight loss if needed, and doing strengthening/conditioning exercises may help improve your flexibility and joint function. It's best to consult your doctor for specific instructions tailored to your condition. If you forget to take a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. Remember to store Ec-Naproxen at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.